Welcome back to Jersey Matters. A New York City doctor is offering home COVID-19 tests and home antibody tests. Here's my interview with Dr. Raphael Kellman. All right, doctor, thank you so much for doing this. I really appreciate it.
My pleasure. Thank you for having me.
Oh, absolutely. Well, we want to have you on because we were caught by the headline that you have an availability of coronavirus tests and
Yes.
also antibody tests.
Yeah.
How do people get them?
Well, in my office, we're doing the COVID antibody test and the nasal swab. We also go to people's homes. We go to patients' homes within a certain perimeter. I'm based in New York City, but we do go outside of New York City as well to offer this service, to do the corona antibody testing in people's homes, and also to test with the nasal swab to see if one has the coronavirus itself.
Is this something new that you have? Because there's been this shortage of tests.
I have no shortage. I mean, I have an unlimited supply of the testing to antibodies. We probably did already 10 today. I could do 100 today. I could do 100 tomorrow. I'm not sure why people think there's a shortage. I think this is the responsibility of any CEO or owner of a business, small or large, to take care of the health of their workers, and that includes, testing.
Now, you're in New York City, but this is available. You would go to North Jersey.
Certainly, if there's enough people in a certain area, we will go to them. But in general, we go to certain areas in New Jersey, Queens, Brooklyn, of course, all of Manhattan, and we do the testing. Frequently, people make an appointment with me to go over results and to discuss what we can do to prevent the virus, and there's a lot we can do, and also the treatment if someone is positive, and what does it mean if someone's positive for the coronavirus or for having the antibodies, and there's a lot to explain.
Do you have to do this in person? Can you send a test and then have an appointment by telemedicine?
Yeah, absolutely. We certainly can. Yeah. And again, we go to one area, even as far out as in the Hamptons, if there's a group of people. I wouldn't go out for one person, but if there's 10 people, then for sure we'll go very, very far.
If there's a company, you would certainly go for a company if they wanted to get their.
Oh, absolutely. 100%. Absolutely. My goal is to test as many people as possible. Because it's very important for the health of the country. It will absolutely make a big difference in our fight against this epidemic, against the coronavirus, absolutely. And it will help to open up the economy. There's no reason why we're not doing massive testing. There's so much to learn about what you could do to prevent. Again, the research is there, whether it's vitamin D or zinc or selenium, or different herbs that they found to be important and potentially very beneficial based on what they call docking studies.
Right. This is a big part of your practice, what you're talking about now.
An essential part.
Mixing holistic medicine with traditional medicine.
Absolutely. You got it. This is a war. And I think that if we take on a more holistic approach, we'll win this war faster, will reduce the severity of the disease, and will absolutely prevent or reduce the incidence of the disease. And again, I'm not saying we could cure anyone with a holistic or natural treatment, but I'll give you one example. Vitamin D itself has been shown to decrease the incidence of developing this infection, but all viruses as well, and also reduces the severity of the disease of COVID-19 if one does develop the infection, including what the outcome if you end up, God forbid, in the ICU and intubated. Those with very low levels were much more likely to succumb and die. Those with good levels were much less likely to die. I mean, the evidence is there. It's just neat. It's incredible that it's not, people are not being told about it. And that's just one. There's also zinc and selenium, and the list does go on.
If somebody wanted to contact you, even if they wanted a telemedicine conference and they wanted to do it from their home and then have a consultation with you, how do they get a hold of you?
So the number here in our office is 212-717-1118. Again, it's 212-717-1118. Our website is kellmancenter.com, kellmancenter.com. And, you know, I treat a lot of people with the virus. We have a very safe situation here, separate rooms. And I see many people for the testing and to give them advice how to prevent, to the best of our ability, the coronavirus. And there's a lot more we can do than just social distancing and wearing masks and hand washing. Absolutely, this is essential. But there's a lot more we can do. And the evidence is pointing in that direction. And I believe that if we follow this, it gives us a whole other dimension to healing and prevention. And it will also give us the sense of empowerment, and that we won't have to feel so defenseless and helpless and hopeless. And this is a very important component in getting better and prevention of disease, the state of the mind, but also in opening up the economy. Because,
Sure.
you know, if people are fearful and you open up and say, yeah, come back to work, people are not going to want to go back to work.
Right, and also just consumer confidence for the economy.
Exactly.
Part of this. Listen, Sarah, I wish I had more time. It was a pleasure talking to you. Let's talk again, and I hope everybody in your family is doing well. I would assume
and
they
you too, and everyone. Thank you for having me.
That was Dr. Raphael Kellman. When we come right back, you'll meet a group that gathered together to feed the community during this pandemic.